Hi, everybody. It's nice to meet you in the air. Yeah. So thank you for Shu-Ping Liu, our president, making a big effort. So many people really for the past months. We just exhausted, but we're happy. Finally, we reached the point. Yeah. So now for this session, we're talking about campus young teenagers' mental health. So we're talking about the university project. So the first one we will invite Poh. She can talk. She's the executive director for Singapore Civil Ribbon. I know the president of Singapore Civil Ribbon is here, Ms. Anne Lee. Yeah, thank you for your attending because Porsche has the other big meeting in Singapore. Yeah, so and she also the board member of the WFMH. Yeah, so let's now have Porsche's video. She already made the YouTube. Yeah, thank you. The technician.
Morning, everyone. From Taiwan, South Africa, Ingrid, Gabby from UK, and Akiyama-san from Japan. And of course, everyone, first of all, I want to thank Dr. Liu and the team for the invitation, and happy World Mental Health Day, everyone. And I'm Porsche from Silver Ribbon, Singapore. And I feel honored to be here to share about mental health advocacy and promotion among the youth in Singapore. Thank you once again for the invitation. So I'll move on from here. So it is a brief introduction of Silver Ribbon Movement. That's my team. And the Silver Ribbon Movement was founded by Jean from United States. And Jean has a son with schizophrenia, and she started this movement in 1993. And back then, okay, it was considered a global symbol to promote positive mental health. And other movements are available in US, Japan, Mexico, India, and UK. And over in Singapore, we launched this movement in 2006. And we feel really blessed to have the support of our late president, Mr. S.R. Nathan, to grace this event. So here are our vision and mission. And we hope to, promote a positive attitude towards mental health among the community. And our mission include to combat mental health stigma, encourage early help, and facilitate integration of persons with mental health issues back to the society through innovative means. And why innovative means is due to the stigma. We have to try all the different ways to get people pay attention to mental health. So what's happening in Singapore is that according to the second Singapore mental health study led by Institute of Mental Health in Singapore, 1 in 7 Singaporeans have experienced a mental disorder in their lifetime. And the top 3 mental disorder in Singapore include major depressive disorder. And over here, you can see that 1 in 16 Singaporeans have experienced major depressive disorder, and 1 in 24 have experienced alcohol abuse, and 1 in 28 people experience obsessive compulsive disorder in Singapore. And according to this study, they show that, and they reported that the proportion of people having 2 or more mental disorder, increased to 3.5% from 2.5%. And of course, we have been talking about stigma. And in Singapore, there are some Singaporeans who perceive that, when their loved one exhibits some strange behavior, they perceive that they are being possessed by evil spirit, and that resulted in delayed treatment. So it's really hard to get people to understand why there's a need to come forward to seek help. So we need to try different ways to engage them in this conversation. And of course, according to the World Health Organization, there's a whole list of misconceptions about persons with mental disorder. Like being, some people perceive that they are being lazy, being unpredictable, unintelligent, and whole list of all these like unpleasant terms that they use on persons with mental health issues. And according to another finding by our National Council of Social Service in Singapore, more than 5 in 10 Singaporeans are not willing to live with or nearby or work with a person with mental health condition. So it can be quite disturbing if you read more on what they have discovered. Yeah. So what are the effects of stigma according to WHO? It include the unwillingness of persons with mental disorder to seek early help or to speak about, or isolation and difficulties in making friends, damage to self-esteem and self-confidence, denial of adequate housing and loans or health insurance. And of course, there are some families and caregivers who are also equally affected by the stigma, and they are socially isolated. And with this, it increased the level of stress among them. So here are the customer segment of Silver Ribbon. We are reaching out to three groups of people. First group will be the mentally healthy, that include general public who would like to learn more about the importance of mental health and identify the warning sign. Caregivers who like to learn more so that they get some tips, they're able to support their loved one better. And of course, we do receive requests from representatives from government agencies, grassroots organizations, religious groups, the churches, the mosques, and the Buddhist group, school institution, social service agency in Singapore, coming forward and saying that, can you conduct a workshop or a talk for our team and members? And another group we are reaching out to will be the mentally at risk, those who suspect that they might be having a mental health condition, but they are still not ready to come forward to seek help. And the third group will be the mentally unwell. So we will split this into the two subgroups. One group will be those who have sought treatment and require further support from us and our partnering agency, or another group will be those who are unwell, sought treatment, but defaulted their treatment due to an unpleasant experience, or they have concern about the effectiveness of the treatment. So these are the three groups of people we have been reaching out to. And what do we do? So we provide public education. And earlier on, I shared about the stigma in Singapore, of course, across the world. So what do? We conduct talks, workshops, and we organize community events, and we share our views on radio programs. And each time after this radio program are being aired, we receive a lot of calls from the listeners sharing their personal concern. And we also host conferences and summit. And in fact, this October, we are hosting the third Asia Pacific Conference, and we are thankful to some of you for accepting our invitation to be our speaker. We are also providing complimentary counseling service to the community in partnership with different member of parliament in Singapore. Yeah, and we also set up a crisis resolution team, And because we receive feedback from clients or persons with mental health issue, saying that they will prefer to be supported by someone who are equipped with like at least basic mental health knowledge when they are very, emotionally affected. And we do provide ambulatory support service. We do provide funding wherever we have caregivers coming forward saying that they're struggling with financial difficulties to engage ambulatory service to admit their loved one for treatment or assessment. Yeah, we work closely with companies and schools on school mental health projects. Yeah, so we have students coming forward expressing their interest to work on projects to advocate for mental health. And we have an internship program as well, which I will elaborate further. We have website. We promote mental health awareness on different social media platforms. And we work with local and overseas organizations to publish articles to raise awareness on mental health. So here are our advocacy effort among the youth. And first of all, I'd like to share this wonderful program provided by Singapore Management University. We have been working with them for years to provide training for students from Singapore Management University, where we equip the peer helpers with basic mental health knowledge. And due to stigma, we understand that some students are not comfortable to seek help or speak to their school counselor. So as such, we start conducting training for the students who sign up for peer helper program to provide support for their peers who are going through a difficult time. And we receive a lot of requests from psychology students saying that they would like to do more to understand the mental health landscape, to serve the needy. So we involve them in our decluttering service and befriending services. So eventually, as more students come forward to express their interest to help out, we actually set up this youth chapter. And right now we have recruited 500 over students from different school institutions to join our youth chapter to advocate for mental health and to serve the needy. As what I mentioned earlier, we do provide internship program and it's up to 4 months. So we involve the students and provide all this exposure so that they could understand the mental health landscape better and learn about what is going on at the community and understand the limitation and the resources available. And they could share their ideas on how we can do more for the community and especially for the youth. And last October, during World Mental Health Day, we are blessed to have Mayor Fahmi. He's the mayor of the Southeast District, and he accepted our invitation to help us to launch this youth mental health resource kit that was jointly developed by our members of youth chapter. So we have a bunch of youth from 10 school institutions to make recommendation for parents, school counselors, friends on how they could support youth that are going through a very hard time. So this was done last October to celebrate World Mental Health Day. And we also hosted this Silver Ribbon Mental Health Award ceremony last December. And we were blessed to have the support of Minister Ms. Gan Xiaohuang from Ministry of Education. She actually gave out award to 5 schools which have been actively advocating for mental health. So with this award, we hope to encourage more schools to come forward, more schools to encourage their students to do more for mental health and to promote mental health in schools. And as what I said, we have been actively advocating for mental health on different social media platforms, of course, including TikTok. Last Friday, we actually had a TikTok live stream event, and we are so excited because there were like 33.8 thousand viewers share their views with us, and it was so exciting. So we always explore different ways to reach out to the youth and other age group as well to advocate for mental health. So we also launched this online survey to measure and understand the well-being of the youth in Singapore. And next, we also continue to host workshops for the youngsters in Singapore and parents as well on how they could support their child who might be coping with emotional issue or trauma. And we involve different policymakers, local and overseas mental health professional in our talks as well. And of course, during the COVID period, it can be very challenging. And I believe you have read about so many articles and reports and research on the psychological impact of COVID-19. So last February, we actually launched this online emotional support, and we have received requests as far as Korea, come forward asking for help. And this service is totally free, and we ensure confidentiality while communicating with persons who are coping with different type of struggle. And we are so happy when Ministry of Education actually made the latest announcement recently on reviewing the guidelines and more support for students, teachers, and staff in the schools. And everybody, in closing, I'd like to thank Dr. Lu and the team for her kind invitation. And for those who would like to explore collaboration with Silver Ribbon, this is my email address. And thank you so much for this platform to raise awareness again and to share about the good work of my team. Thank you so much, and take good care, and happy World Mental Health Day.
So I would say, happy World Mental Health Day, not only one day, but the whole month and also the whole year. Happy mental health. Every day we have a mental health feeling. So thank you for Porsche to share the experience of Silver Ribbon Singapore. So now we shift to Shu-Ping Chen, Dr. Shu-Ping Chen. She's a professor in University of Alberta, Canada. And also, I think she has an important involvement in CCMH Commission Canada Mental Health. They have much more research and also implementation. So thank you for Dr. Shu-Ping Chen. She helped us to know more about Canada. Yeah, thank you. Please, Dr. Shu-Ping Chen. She will talk about student voices on campus mental health.
I believe somebody will play my video, right? Hello, everyone. My name is Shu-Ping Chen. I'm Associate Professor at the University of Alberta in Canada. Today, I would like to talk about student mental health in Canadian universities, with a specific focus on student voices and the campus mental health strategies. Mental health problems has become a growing concern in higher education. Here is the numbers. In a 2016 survey of 43,000 students in Canada, 18% received diagnosis or treatments for anxiety, and 15% received diagnosis or treatments for depression. If we look at recent data, in 2019, among 55,000 students, 64% reported feeling hopeless, 88% have anxiety, and 52% felt so depressed that it was difficult to function. So we all understand that the transition between adolescence and adulthood can be a challenging time. Unique factors during this period, such as a higher level of stress and anxiety, being introduced to alcohol and drugs, and the new experiences and responsibilities in universities can all make students vulnerable to mental health problems. So what are the contributing factors that lead to students' poor mental health? First, their level of mental health literacy. Mental health literacy is defined as knowledge and belief regarding psychological disorders, which in turn foster the ability to identify, manage, and prevent such disorders. Good mental health literacy allows for students to seek mental health services, as students are able to aware of common mental health problems, demonstrate an understanding of treatments, and know where to reach out for help when they need. Like a student said, I think a big thing was self-awareness. That's like a very big turning point where you realize that it's not normal to feel this way every day. Second, students may not be fully equipped with the tools to manage mental health issues. This will negatively affect their productivity levels and their daily lives. This may be the result of lacking education regarding mental health coping strategies and the crisis management skills. For example, a student shared, there is mental health problems that you also want to talk about, but you don't know how to talk about it. The third factor would be stigma, including public stigma of mental illnesses, as well as internalized stigma and the pressure to disclose. The stigma of mental illness on campus can force students to stay silent about their hardships. Students fear facing stigma. As a result, they use non-disclosure as a defense mechanism against stigma. In addition, internalized stigma can lead to avoiding help seeking, like a student shared. I think sometimes seeking help can also be like a sign of weakness, and that kind of stop you from going to seek help. Like you feel like you should be able to deal with these things by yourself. However, students also voice that I think the best way to eliminate stigma is to get people to talk about it. So for those individuals who have no experience with mental illness or don't know anybody with mental illness can get a better understanding of it. And then they have people who they could ask questions to and get a better understanding of it. In terms of the system level, I think insufficient promotion and information delivery of mental health services on campuses would be the major barrier. Students often did not know that services exist or that the available services will apply to their specific situation. In addition, students also advocate for support network to be shifted from a reactive model, such as providing treatment or services, to prevention. To respond to the growing mental health needs and the students' voices, Canadian higher education system has developed a series of mental health strategies. Today, I will use WHO's Healthy University model to organize these Canadian campus mental health strategies across the spectrum from prevention to service delivery. These include, first, develop personal skills. Second, create a supportive environment. Third, build campus mental health policies. Fourth, strengthen community action. And the final one, develop mental health services. I will introduce each strategy separately. The first strategy, developing personal skills. including raise awareness of mental health at a personal level, increase mental health literacy through educational approaches, and develop mental health resources and toolkits. I will introduce 3 approaches as examples. First, for-credit wellness courses. In Canada, students' services always struggle to reach students with messages about wellness and mental health support. So, what if students were offered wellness courses as part of their program of study? So the purpose is to deliver topics of mental health and well-being into the core university curriculum. This can help generate a campus-wide culture of well-being. It can reach a large number of students. It's low cost to the university, and it can reduce barriers to use services and increase opportunities for student engagement. The courses can address well-being needs from a skill-based perspective. The second approach is mental health workshops. On each campus, there are various mental health workshops available for students. Here are some examples, like Discover Yourself, Anxiety Management Group, Healthy Thinking Workshops, Mental Health First Aid Training, etc. Particularly, Mental Health First Aid is an educational training program where participants are trained to help others in crisis related to mental health, improve mental health knowledge, recognition of psychological disorders, and the knowledge of effective treatments. The purpose of this workshop is to equip students with knowledge and skills to self-manage their mental health, help students to learn tips and strategies for how to engage in better self-care and care for others. Third, developing campus resources and toolkits for self-management of mental health issues. Evidence shows that these programs have a positive impact on student mental health literacy. This indicates the importance and the potential benefits of educational approach in this area. To address mental health issues at the environmental and the community level, the second strategy is to create a supportive campus environment. There are many campaigns on campus to reduce the stigma of mental illness, to promote an equal and diverse learning environment, and particularly in each university, there is a peer support program for students to help each other. For example, in my university, all of our volunteers are medical students who have demonstrated a genuine desire to help their peers. They have been trained in supportive listening, community resources, and the topics in suicide, interpersonal violence, and addictions. Other students who need support can book appointments with these peers to talk about their issues in a safe environment. In this way, students can receive support from each other. Here is a quote of student experience. The university has peer support where you can just walk in and get one-on-one peer support with someone, which is really great. The other example is Bear Let's Talk anti-stigma campaign. Bear Let's Talk Day is a Canadian national campaign began in 2010 to initiate the conversation about mental health. It invites millions of Canadians to participate in an open discussion about mental illness. Every year in this day, people are encouraged to talk about their mental health, especially university students. We can see the effect like a student shared. Their Let's Talk Day come around and the people start posting all over Facebook, being like, I start out on this and got more comfortable with it. And now I'm better. I want to help other people get better. The third strategy, building mental health policies, refers to the development of specific policies and strategies that prioritize mental health. You can see the example of University of Calgary here. One of the university's 6 strategic focus is align institutional policies, process, and procedures with mental health as a priority. Based on this focus, they developed a process to ensure that relevant campus policies and the process are supportive of mental health. The university creates a committee responsible for implementation of the campus mental health strategies. Another example is the early alert system on post-secondary campuses that establish policies and procedures to early identify students in need of help and provide intervention. The next strategy is strengthening community action. Many campuses have innovative mental health services and programs in place for students. However, sometimes they struggle with student engagement. I would like to focus on student engagement here. We want to build capacity to empower students to identify and respond to students' experience and to design interventions that tailor to students' needs. Thinking of how to empower and involve students as mental health advocates. Here is an example of the Student Summit model developed by Jack.org. We bring students from different campuses together to learn mental health, share experiences, learn best ways to improve mental health of their peers, and exchange big ideas, build network and resources, and to develop their action plans. So after this summit, students go back to their campus to lead their local initiative for mental health promotion. The key point here is student-driven and student-led. Young people are passionate to make changes, make the world better. In this way, they create a social movement. They are able to contribute to the mental health of the community. The final strategy is to develop, review, audit, and monitor university mental health services that respond to students' needs. The campus services must be inclusive, appropriate, and accessible. Currently, every campus provides mental health services, including like clinical and counseling services, community services, university health center, drop-in center, crisis line, sexual assault center, student success center, substance use support, to name a few. Each service provides a different function and no charge. So today, I have reviewed 5 major mental health strategies in Canadian universities. Looking forward, there are still rooms for improvement. In particular, the accessibility of services is very important. As Canadian Mental Health Association has emphasized that improvement in mental health service accessibility can lead to greater retention of university students. We also need more system-level integration and evidence of intervention advocacy. More importantly, we need to hear students' voice and empower students to design and lead actions that will improve their mental health. Thank you for listening. Hope to have a great discussion and sharing later.
Thank you. Thank you for Dr. Shu-Ping Chen. It's really marvelous because I think from Porsche, based on association and developing the program, and now Shu-Ping based on university experience and develop some program. So I think this is really can give our audience a lot of reference. So I like to share my responder, and I'm so work hard because they asking say we need to have translation English and Chinese. So I try to use my English and Chinese to share with you. Yeah, and let me see. Okay, yeah. So I will say thank you for both of Porsche and Shu-Ping. They both talking about we need to listen the youth voice, but that means we know the self needs about the people. The student also have so many different kinds of students. You have disabled students, you have some family problem students, and you also have some students but they need in need, but they don't know. Yeah. The second program is they have the in-campus development. And most important, they try to do systematic development. So Shu-Ping introduced the Ottawa Charter, the model is really important. And also, Shu-Ping and Porsche all raise some data, some big survey to make some reference as an evidence base. So this is really important because I'm so envy for that because in Taiwan, we really don't have a lot of large data for students' situation. Yeah. So Singapore is really best. They, from the organization, they can do the youth charter. It's not easy. And also because the youth charter, they work with the university, the student can be internship, can be learn a lot of, not only learn their basic mental health literacy, but also aware some mental illness symptoms. They also self-help and also make peer support group. I think this is really good. And also because those kind of training, the student, 500 students as a youth charter is not easy. It's not easy. It's really good. So I think they do some good practice and show to all of us we can take as reference to practice in our own environment. Yeah, they also publish some book. They do some big campaign, invite the big shot people come to attend. I think Fatima here is always a big shot, attend the lunch in Singapore. Yeah, and Shu-Ping used the also evidence-based to make the evidence to introduce the mental health program in campus. And Ottawa Charter, the 5 Ottawa Charter is really important. So I really appreciate that Shu-Ping can make such clear introduction and tell us how we can do in the campus. So now the model, I will use this one in Chinese, so people can understand how we take the stuff to apply. And also because the Ottawa experience, so we can have the healthy city, health community, but our government sometimes has pay less attention on mental health in campus. So right now, this is an opportunity. Shu-Ping provide us an example. Porsche give us some encouragement for the NGO also to provide the such as a good cooperation. Yeah. Okay. So right now I only show like, because Shu-Ping mentioned the school students need to have mental health training. But in Taiwan, we have 1,200,000 students, but only 10,000 students get the mental health related course, only 0.8. So this is really bad, very, very sad. So because we have different countries' experience, then we will try to push our government. They need to take care about those stuff. Okay, so I think I will finish here because we also talking about introduce a quick, because even we have some regret But we also have some exciting stuff. Our government also start to pay attention on the youth. So we have the Youth to Development Administration, Ministry of Education. They try to do the open government, invite the youth to participation, to talk about what they emphasize. So this time they emphasize mental health is what they need. And the other, we have a GIS, global international student talking about global forum, global issue symposia. So they also this year they raised the issue as mental health. So I think this is very good. Okay, so they have some idea. So they're talking about mental health, but now they change into pandemic resilience and social resilience. It's good. Yeah. So I think I will stop here, because when we talk about mental health program, we really need to think about it's a long time. We have prevention, not only individual, we need to have school, community, and setting. Not only talking about vulnerable people, we're also talking about the resilience of them. And not disempower them, we need to empower them. It's not short term, it's a long term. Yeah, it's not only one person's effort, one organization effort. We need to collaboration. Yeah, I think I just finished here. Okay. So I think we need to have Public Mental Health Act, Promotion Act. And also this picture I like, just like if students have more mental health promotion, basic mental health literacy, they can, like a bird sitting on the tree, but they're never afraid of the branch breaking, because he trusts it's not only the branch, but its own wing. Okay, so we'd like to thank you, Shu-Ping and Porsche again, and we need to integrate mental health into all university policy. Thank you very much. So right now, I'd like to invite people, you can share, when you listen Porsche, you listen to Shu-Ping, Professor Shu-Ping, what is your feedback? I already finished my feedback. What is yours?
A question to Dr. Chen. My question is, thank you, your wonderful presentation. I want to, I'm a psychiatrist in Taiwan. My question is, how to perform this integrative model to cooperate with the off-campus psychiatry service? Thank you.
I'm thinking for a comprehensive mental health strategy must include from prevention to treatment. So psychiatrist is one of the collaborators in the entire mental health campus mental health promotion system. So if we can invite psychiatrists into the campus to like lead some mental health promotion activities that from the prevention side, I think it would be it would be great. And then linking from prevention to treatment. I'm sure if I answer your question.
It's really important, because all the medical services is not in the clinic. They need to go to community. And also we emphasize all the people in need, their experiences. So I think both Shu-Ping and Porsche mentioned about internship. Also you're talking about training the medical internship, the students, and they try to discuss find some questions and find some solutions. Just like I mentioned, our government or GIS try to make students try to looking about the problem and action and how we really met the needs. It's really important. Yeah. Okay. Anyone like to talk, to give feedback?
If anyone in Suicide Prevention Society, such as Professor Chen Junyin 院长 or Professor Liao Shi-Cheng, he is a director in Taiwan University about the counseling department. Yeah, if anyone here? Oh, no?
Or Professor Lee, Ellen Lee, the president of Singapore Silver Ribbon. Do you have anything to add?
Yes, I think Prof. Chan actually gave a very good presentation about, especially I like the last part about how much efforts have already been put to help the youth. And I think that is really remarkable because helping youth is not something that is easy. You know, the youth being young people in an Asian society, I think parents are very conscious of the stigma that could be attached to their children if they are known or there is any suggestion of mental challenges that are faced by the children. I was wondering that how did Taiwan manage to overcome this stigma, you know, to help parents accept the fact that mental health in the children, in the youth, is something which is actually quite normal, and how do we actually encourage them to come out to help their own children without feeling, without any feelings of fear and stigmatization? Perhaps you could help us to explain, you know, how Taiwan is successful in this aspect. Thank you.
I think there will be both sides. The stigma we need to face, and also need to have more people join. I think just like Janet mentioned about consumers' participation, we have so many different consumers, the disabled people, the physical disabled, and so, and psychological disabled. But right now we don't like to say it's disabled. They just have some experience. They need to face that. So everybody have those kind of experience. That's why I think the education is really important. Singapore have the experience. We also try to train also not only the negative part, we also put on the positive side. Because some students can stand up to talking about their own stories in their class. Yeah. So that is really good, because I have a class in university. I invite my students come stand up to talk about it, and really gave so many insight to other students. But now I just like I mentioned, we don't have not too many classes in our university. So this is what we need to make our own efforts. Yeah.
Yes, yes. I think perhaps you may have heard about it in Singapore. It has always been a subject not to be spoken about until sometime in middle of this year. There was a student who actually killed another student in the school, and that became a very big piece of news in Singapore. And I think that was when our policymakers also started to have a platform within which to mount efforts, all-out efforts to raise awareness of youth being overcome with mental health challenges. So although I'm sad that it has to take such a tragedy to spark that concern, but the good thing that came out of it is that it's now no longer regarded as a big taboo subject. Everybody is trying their best to try to see how they can prevent another such tragedy from happening.
Yeah. So, Dr. Chen, do you have any feedback?
I think I would like to share an evidence-based approach for anti-stigma intervention. We call contact-based education. So we have people with mental illness to share their successful recovery stories with the general public or with a specific audience. As a result, people can change their misperception toward mental illness, especially they understand that there's a recovery, people can recover. So we have this kind of contact-based education around the campus So, and we evaluate and we found is effective to change people's attitude and behavior toward mental illness. So, yeah.
Okay. Yeah. So finally, I still like to ask Janet, do you want to talk something? Because you are memorable for all the campaign for the consumers. I think the consumer is not only for psychologically disabled people, but also for physical disabled people. Yeah.
Absolutely. And I do think that there's, can you hear me?
Yes.
I do think that there's a very fine line that we have to look at. Not every person who experiences a mental health issue is a disabled person or will be a disabled person. And our goal should always be that they won't become disabled by the illness, the treatment, or the care. And any of those elements can become the most disabling. So we need to not correlate the experience of a mental health issue with the disability that arises, which is called a psychosocial disability. And I think once the person has an entrenched and distressing mental illness that has impacted on their life and the career that they've chosen, then that's the disability. That's the psychosocial disability. And for that, we need specialised services that encourage recovery. And because no matter how disabled you become because of your psychosocial disability, no one should give up hope that they have a right to a life that's full and complete and that has choices and options. So I think when we're talking about these issues, whether it be students or people who are in training for trade or professional jobs or people who haven't yet started work, the real issue is about preventing the disability and ensuring that people get as much appropriate support as they can, regardless of where they are located, regardless of their social standing, and regardless of their physical access to care. Everyone should have access to care and support that's appropriate and empowering for them, not just imposed on them. Thank you.
Thank you very much. I think that will be a conclusion for our session, because everyone should have mental health. It's our right. So we also need to face some difficulties and solve them. This is our own job, our own work. But everyone has their own work. But we can work together and make everyone have a mental healthy way of life. Yeah. Thank you. I think it's school, university education. Even we need to start to when the children are young. Yeah. So all are important. Thank you very much, and welcome all you come. So now I hand to Shu-Ping. Right, it's our closing time.
Okay. Thank you, everybody. Attend this conference. I think it's very successful, and thanks six speakers devote so much time to have the video, and then we have a translator for our Mandarin in subtitle. And the last, I think three moderators, include me, Professor Zhang, and Professor Wu, and they all organized very well. And thank you, Julie, Wallace, Nancy, and Ellen. I think it's a great meeting for us conference, and I think not the close, but another beginning. And this conference is WMHD, the first in this year. So I think it's a very good congratulations, and the last, and happy Mental Health Day. Happy to everybody. Thank you again. Thank you. And that's,
Thank you.
Yeah, and some people ask she didn't have the photos. So if you like catch the photos again, would you might open the camera again? Let's have the last pictures for us, and then okay.
And also, I think we have some ID code that is asking for feedback, or if you like to have some certificate from this conference. So we just take the photo. Yeah. Okay.
So before you sign out, please finish the questionnaire, and then we have the certificate to your email, and as soon as possible. Okay. So, okay, shall we open the camera? One more pictures. Okay. Remember to have the questionnaire. Okay. Professor Li Yuchan, President Li.
Hi, everybody.
Yeah.
许美月.
Mei Yue.
Yeah.
Thank
you.
Professor Li mentioned about she didn't in the photos. So we take the pictures. One more. Okay.
Okay. 3, 2, 1. Okay.
Thank you. And thank you, our organizer, Occupational Therapy Association, WFMH, and National Open University, our Professor Jianlian Liu. She do so much work for us. And the team, Sylvia Chen and Yan Yun and Junhan and Gui Jun, and Mei Hua. And I thank everybody for this conference. Okay. Thank you again.
And this afternoon, we still have continued forum. It starts from 1:30 to 5:30. It's also very reachable. So also welcome you come if you can listen Chinese. Yeah, that is really talking about the unequal society, how we to see the unprivileged people's mental health. So we have physical disabled person, and we have the
mental illness,
several palsy
people.
Yeah, the mother and the kids, they're talking about their own experience. And also we have psychiatric patients to the social worker work with them, how we experience the COVID-19 period. So right now we're all still in the disaster period. And the other one, we're also talking about university campus, the international students adjustment in campus, or the Aboriginal people, how they have some difficulty or they going through the campus life. Yeah. So welcome you all if you are interested. So I think our worker will make the connection also in the here, and you can know in the afternoon you can attach to the other website.
Okay, thank you, Professor Zhang, and thank you everybody here, and have a good day, and Saturday, Monday, Sunday, holidays, and happy mental health day to each one, to everyone. Okay, see you. Bye-bye.